I see it's 1 o'clock, so there we go. We're gonna start. My name is Natalie. I'm working for the Better Project, and I'm so glad that you can join us today for this webinar on Mediterranean diet and type 1 diabetes. We had the idea to have this topic covered after we held a previous webinar on a low-carb diet. So we have the pleasure and honor to have with us today Maha Saidi. She has been a registered dietitian and certified diabetes educator for more than 15 years now. She has a master's degree in international nutrition. She's also a certified product trainer with Medtronic, Insulet, and Tandem. She has worked in various diabetes clinics in Quebec and Ontario with type 1, type 2 diabetes, pre-diabetes, and gestational diabetes patients. Maha participated in many diabetes-related conferences, expert committees, research projects, and communication. So, Maha, I hope I didn't miss anything. Welcome, and thank you for being here.
Thank you for inviting me.
I guess just before you start your presentation, I want to tell you that you cannot ask questions directly to us. We will not be able to answer them. So please use the Q&A below your screen, to ask your question, and we'll try to answer them as much as possible at the end of the presentation. So please, the Q&A and not the chat, and not raise your hand. We cannot see it. So that's it. So Ma, the floor is yours.
Thank you. So thank you for inviting me. I'm excited. We're talking today about the Mediterranean diet and what's the place of that diet in the management of a type 1 diabetes. Okay. Here we go. So what we're trying to do today is to present the nutrition position in managing diabetes. Then we're going to describe the Mediterranean diet and discuss together. I'll be discussing the health benefits and where does it fit? Where's that diet fits in the type 1 diabetes management? So we're talking about nutrition therapy now because food is a treatment in diabetes. What happens in the guidelines, it's really central. It's part of the management of a type 2 diabetes. But in the type 1 diabetes, with the food, we also need to take into account the insulin dose, the timing of the insulin, and then the glycemic index of the meal to be able to have a optimal management of the blood sugars. So it's not only the food itself, is how do we manage that food with the insulin. So the guidelines, they talk about improving quality of life. It talks about preventing and treating long-term complications of diabetes. Sorry, I'm looking at mistakes, so I'll correct them later. And we're trying with that to reduce the risks of long-term complications. So not only managing the diabetes, but also taking care of those long-term complications. Now, in type 2 diabetes specifically, the A1C could be reduced 1 to 2% if we take care of the food. Okay, if we use that nutrition therapy, but it doesn't mean that it's the same with the type 1 diabetes, because we have other factors that we need to take into consideration, and insulin dose and timing of that insulin is a major part of it. What we also do is we adapt that nutrition therapy to the type of diabetes, your personal preferences, and if you have already some complications related to diabetes. So it's not one size fits all. So we really need to adapt that considering. It's like medication. The doctor will take into consideration the side effects of a medication and look at the risks you encounter if they're giving you such and such medication. So it's the same thing for the nutrition therapy. Oops, sorry, I left it in yellow. So it is very important that to consider that we don't have one right way to eat. We have to look at what suits you, what suits your needs, what you like to eat. If I tell you, well, fish is good for you, but you hate fish. So what's the point? You know, we're not going to be miserable because fish is healthy, you know. So that's why we have several dietary patterns that are beneficial and that can help us long term to prevent health issues. But today specifically, we're going to be looking at the Mediterranean diet. So for the Mediterranean diet, it's also called the Cretan diet. It is invented in the 1960s. It is inspired by traditional cuisines of Southern European Mediterranean countries like Spain and Italy. And this is a diet or food pattern, if you want to call it this way, that is not concentrating on specific foods and saying this food is good and this food is bad, but it's an overall it's a lifestyle. It's sitting and enjoying a meal with the family, cooking with the family, having a moment to ourselves, reducing stress, enjoying what we're eating. And that's why it was put as a heritage. It's a cultural heritage of humanity. And that was labeled by the UNESCO in 2010 to aim for a lifestyle with less stress, with more enjoyable food intake. So it's really another way, in a way, going back to our ancestry ways of eating and sitting all together on the table and cooking at home, and not necessarily, oh, banana is good or not good for you, or tomatoes are good or not good for you. So it's not necessarily labeling those foods. So what you should know about the Mediterranean diet. So it is a plant-based food source. So we're going to aim more for the food coming from plants instead of coming from animals, because it reduces our cardiovascular risks, and that improves blood sugar control, blood pressure control, and also the blood cholesterol. And mainly that diet is recommended to reduce significantly major cardiovascular events. Now, if we look at the studies more specifically, it shows that the Mediterranean diet reduces mortality, morbidity caused by cardiovascular diseases, and it reduces also the risk of Alzheimer and Parkinson's disease. I didn't go into those more in details, but it showed that it could help. Now, the impact on the weight is the same as all other diets, because weight is multifactorial, and it's not only about the quality of the food that we have. It's also other factors that we need to take into account. And today I'm not gonna go into that. It takes, like, we can talk about it for a long time. Now, when we're talking about the Mediterranean diet, we're talking about the fat. So the fat intake impacts our cardiovascular disease risk. But this study showed that it's not the quantity of the fat that is important, it's the quality of the fat that we need to take into consideration. So here it shows that in Finland, we have the same amount of fat intake, 38%, compared to Cretan people. So here, what's different, and see the cardiovascular risk is different in both. And what's the difference is the fat from the Cretan diet comes from olive oil, nuts, so vegetarian sources of fat, compared to in the Finland diet. So this comes from butter and from dairy fat, so animal fats. So what's important to consider here, it's not the quantity, it's the quality. So where are we getting our fat from? And this is what the Mediterranean diet is based on. So if we look at, this is from the Institute of Cardiology. So we have the whole grain product as the base of our pyramid. So the bread, the pasta, cereal, rice, and we want them whole grain. So multigrain, brown, to go get the fibers. Those fibers are very important to help reduce the absorption of the food cholesterol, and also help the liver produce less cholesterol, like internal cholesterol. We're also aiming for fruits, beans, vegetables. So those are all every day. Olive oil or canola oil, we're gonna use them to cook, to use in our salads, to go get the benefits from monounsaturated and polyunsaturated fat. And we have the dairy, low-fat dairy product like cheese, milk, and yogurt. And that also gives us probiotics and calcium, which could also help control the blood pressure. For the fish, the red meat, poultry, this is a few times a week. But if we look at the Diabète Québec pyramid, the red meat will be few times a month. So it depends really on the pyramid that we're looking at. It changes depending on how they interpret it. And for the sweets and the pastries, because they're rich in saturated fat, trans fat, those are to be limited because they're very the impact on the cholesterol is really important. So we have to limit them. And we have physical activity every day. And I think this shouldn't be a surprise to anybody. And we can consider red wine in moderation because we have antioxidant from the red wine, which reduces the inflammation. So this is other version of the Mediterranean diet. So we have, this is one for the biodiversity and eco-friendly pyramid, where we're encouraging people to cook at home, use less plastic, grow their own fruits and vegetables, so we can reduce the eco print on the ecosystem. So this is the Mediterranean diet guides us to choose a good quality of the food through choices at the grocery. So what do we choose to buy? Food that are not transformed, as in their natural state as possible. So example, fresh tomatoes instead of tomatoes in cans, example. We also reduce the frequency of the meat. So we have tendency to say, so the pyramids, they're gonna change. Sometimes we're gonna say few times a month instead of few times a week, and go towards fish and chicken, and instead of going towards red meat, to try to reduce what we call the saturated fat. And we also we can review the recipes that we are using for our homemade meals to introduce more legumes, so more lentils, beans, chickpeas, nuts, and reduce the red meat. So let's say we're doing a shepherd pie, homemade. Maybe we can mix our red meat with some lentils. If we're doing chilies, maybe only put red beans instead of putting the meat with it. So there's ways to incorporate and change our recipes to make them Mediterranean style in a way. In parallel, we are looking at the quantity, and this is where we need to calculate our carbohydrates, because living with type 1 diabetes, we need to match those carbohydrates with the appropriate insulin dose to be able to manage the blood sugars. So the Mediterranean diet as is doesn't necessarily control the blood sugars, because we need the management of the blood sugars is related to the management of the insulin. Now, what we can do, and you had it previously in a different presentation, we can still combine a low carbohydrate diet with the Mediterranean diet by choosing food that are less carby in a way. But that's gonna lead us to less choices. So it's like we're cutting on good food so we're restricting in a way to aim for that low carbohydrates. This is where a personal choice will come into place. Because if you tell me, Maha, I prefer having low carbohydrates so I don't have swings in my blood sugars and it keeps it steady, who am I to decide? It's really your choice. What is your priority and how you are dealing with it goes back to you. As long as a dietitian, I'm making sure that you are not missing on essential nutrients, we can still supplement in other ways if this is the way you want to go with it. Okay, so don't hesitate to discuss it with your dietitian to see if it's appropriate or if you're missing things that we can compensate in a different way. So this is a small summary because I'm very, in a way, I like numbers. So this is a summary to guide you a bit in your week. So what we're aiming mainly is to cook with olive oil, okay? So instead of margarine or butter. We're gonna use spices, herbs, condiment to go flavor our food instead of using salt. And this is very important to take note that some of the spices mixes that you can buy could contain salt. So it's very important to read the labels to make sure that you are having, there's no extra salt. We're gonna, and this is no surprise, a lot of fruits and vegetables every day, nuts every day, like a handful of nuts, and you can change it. One day walnuts, one day almonds, one day pistachios, so it's not boring. That's gonna give you antioxidants and fibers. We're gonna go towards whole grain version of grain products. So whole wheat pasta, for the rice, like brown rice, parboiled brown rice. So those are things that you can go towards to help the blood sugar, but at the same time, aiming for all those antioxidants and fibers to help protect to get the cardiovascular protection. Cooking at home, less processed, more fresh, seasonal and plant-based food. So this is no surprise, I'm hoping. We're aiming for dairy products that are less, with less fat. Red meat occasionally. The fish, we're aiming twice a week. I recommend fatty fish, so salmon, trout, mackerel. Those, why we go to fatty fish is because it's rich in omega-3s, and omega-3s showed that it's cardiovascular protective. We can have 3-4 times a week some eggs, and we need to limit the sweets and the cakes because they are made with saturated fat and trans fat that are very, very damageable to our artery and to our to the cardiovascular risk. The water, always water, always water. So that's also no surprise. So there's things that are common to all the diets we're gonna recommend because unfortunately we don't have other options that are not with side effects. And regular physical activity stays in the center of it all. This is just an example of a menu, just for you to get inspired, not necessarily to follow this, but people are out of ideas, so I'm just putting it out there. But Diabète Québec or Diabetes Canada, they have full recipes that you can look at. We have also SOS Cuisine that you can go get ideas from there. This is a grocery list that I'm putting it here because what I'm realizing with all those years that I've been working, that we need something to rely on just to get inspired or to confirm that it is okay to buy this or this food. So this is a grocery list to guide you when you go to the grocery and then to get you to make recipes based on those food. So don't hesitate, but it's always keeping in mind that we need in the grains the whole grain version of it. So when we're going into the bread, well, we need the whole wheat bread or the what we call it, the integral flour, so the flour that is less transformed. In the oatmeal, for example, we need the steel cut oats, and the pasta, the whole wheat version of it. The quinoa is very good. The rice, we can go to the parboiled or the converted rice because they are better manageable with the blood sugar and the insulin. We also have the vegetables. So this is a list. If your vegetable is not in the list, that doesn't mean it's not good. It's just that we cannot list it. Otherwise, it's going to be an hour of just listing the vegetables. So be open to any fruits and vegetables. They're good. The herbs, Diabète Québec, they have a very nice document on how to use certain herbs and spices with what type of meat, chicken, fish, eggs, so to get the taste marinated together. Those are all examples, and I'm also putting you here the Diabète Canada meal prepping and plan. You have cookbooks. I also recommend to my patients to go to the local library, and you can, get inspired. There's a lot of versions of cookbooks that you get inspired from. Now, where do we place the Mediterranean diet in the management of the type 1 diabetes? And this is very important to understand in a way, because the Mediterranean diet is not a fix of the type 1 diabetes management. It is not. Why? Because, so if you follow me here in the orange section, the type 1 diabetes is a lack of insulin production. So the body is not able to produce insulin at different extent. It depends if it's a type 1 or it's a LADA. So the body is not able to produce sufficient or not at all insulin. And that's why we need to give ourselves the insulin from outside to manage the carbohydrates that we're having so the blood sugar doesn't rise after the meals. And this is where carb counting, unfortunately, I know it's there. Carb counting comes to help decide the dose of insulin that we need to take to manage the blood sugars after the meal. In parallel, type 1 diabetes increases the risk of cardiovascular diseases. And to deal with that, this is where the quality of the food and the choices we make is going to help to reduce that risk. And this is where the Mediterranean diet, among others, we have other options, but the Mediterranean diet did give us good results to reduce the cardiovascular risk, help us into reducing the insulin resistance. That means we reduce also the need of insulin. So for the same meal, if we eat it in a restaurant versus we eat it at home, we make it at home, it's the same amount of carbohydrates, but the insulin dose could be less for a homemade meal. And if we use less insulin, this could help us maintain help us manage the weight, maintain it stable. So when we're doing that part of it, so here in the blue section, it's still important, whatever we have in our plate that is Mediterranean style, we need to carb count and take the insulin accordingly. So we cannot just say, I'm eating Mediterranean, I don't need the insulin. We still need to take insulin according to the carbs we're having. So I hope that's clear, because it's important. It's two things that are going in parallel, and each one is treating something different. So what's the benefits and the limitation of that diet for someone living with type 1 diabetes? So when we're having vegetables and protein in a meal, that helps improve the blood sugars after meals. So there are studies shown that if we start the meal with vegetables and with protein, for the same amount of carbohydrates, so for the same amount of rice, the postprandial peak, so the insulin, the blood sugar after the meal is lower. That means that we need less insulin to manage the same amount of carbohydrates. But that doesn't mean that we don't need insulin. We still need that insulin to manage that. Also, the Mediterranean diet, that does not necessarily reduce the glycemic variability and improve the blood sugars, especially if we don't take the insulin accordingly or at the right time. If we don't take into account physical activity, sometimes we need to take into account stress. And all those things are not in the Mediterranean diet. Those are factors that we have in the environment that we also need to take into account to make the decision into the dose of insulin. Now, a study in teenagers living with type 1 diabetes showed that there's no effect on A1C, on calorie intake, or on the weight. But it showed that we need less insulin for the same management. So at least we reduce in the overall total dose of insulin. This is a case, one of my patients who follows the Mediterranean diet. And this is just to show you that we don't have see the ups and downs depending on the day. And even though she's following the Mediterranean diet, we really need to account for the dose of insulin, when to take it, the carb counting, the physical activity that goes with it is very important to get the management, the optimal management. And as you know, every day is different. It depends on the day. It depends on the stress. It depends on the level of physical activity, whatever happens that day. So that's why those new technologies that we have with the alarms, with the arrows, will help us make decisions to manage on an hourly basis, you know, the blood sugar control. So this is just to show you how can we adjust and time the insulin according to the glycemic index of the meal. So let's say we're eating only fruits and we're taking, someone is having a breakfast, only fruits. So the fruits are complex sugars. So they have fiber, so it's not juice. It's not juice is simple sugar. So in that situation, see the digestion peak of the fruits doesn't match the insulin peak. See here, the peak is way later on, which lead us to a higher blood sugar, and the fruits are part of the Mediterranean diet, and it's on a daily basis. So the peak, it's going to go up within an hour and a half, and then when the insulin kicks in, we have digested all the fruits, and then we go really high, and then we go low later on because we have extra insulin on board. So that's why we're trying here. We have two solutions, either adding some protein to those fruits to make it more, when we add protein, we slow down the absorption of the sugar, which is going to mimic the inaction of the insulin, or we move the insulin injection way earlier on so the peak of the insulin matches the peak of the digestion of the fruits. Now, if we're eating a salad, let's say with eggs, I don't have carbohydrates in there. So it's more like a protein type here. And I still do have some patients that need some insulin for the vegetables. And it depends on the situation. That's why you sit with your dietitian, because your needs are different from a person to another. So in that particular situation, the insulin is going to kick in way before the vegetables and the eggs, see, because the digestion is way slower. And this is where you can either correct after your salad or take a mini dose before and then watch the trend of your blood sugar. Where are you digesting that salad to complete with a different dose of insulin? So you have to manage it accordingly, but we're still in the Mediterranean diet. And finally, if you're eating, let's say, salmon with some vegetables and brown rice, this is more a balanced plate. And the balanced plate the digestion of that plate mimics how the insulin action works, which will help control the blood sugar after the meals. And that's why we say the insulin, in that case, we can take it before eating so both of them come together at the same time. Now that we looked at the food, how do we manage the food in a Mediterranean diet, we also have to take into account the impact of the alcohol on the blood sugar control. So we cannot, yes, the wine, red wine protects, we have a protection, a cardiovascular protection, but we still have a risk of hypoglycemia that could occur during the night, or it could occur the next day after breakfast. And that we need to manage the insulin accordingly to avoid those situations. Now, the management is different if we are on a standard pump versus an automatic pump versus on multiple daily injections. And on the multiple daily injections, the way we're going to manage the risk depends on if we're using Basaglar, if you're using Toujeo, or if we're using Tresiba, because the action of that insulin, the action peak is different. So that's why I would encourage you, this is a whole, we can talk about it for an hour. That's why I'm going to refer you to go see the webinar on alcohol and type 1 diabetes. And sometimes we're gonna reduce the insulins, but sometimes we're gonna use carbohydrates without insulin to manage that risk. It could be in the evening or it could be in the morning. So it depends where does that situation happen. So this is just an example of someone on multiple daily injections. And like you see, we have a glass of wine at supper. And then as you see here, the hypoglycemia is happening at night. Okay. So we were on the old version. It didn't ring. We didn't have the alarms. So see, this person spent most of the night in hypoglycemia. So in conclusion, so I can answer your questions after, the choice of a diet is really based on your personal choices and preferences. But when you're talking with your healthcare professional like me, I'm also going to take into account the prevention or the treatment of other health issues that you're having with the diabetes. The Mediterranean diet doesn't fix or manage the diabetes, but it helps guide the quality of the food you're having for a cardiovascular protection that could be a risk related to type 1 diabetes. Again, we circle back to our healthy plate because if we're having fibers and protein with our carbohydrates, this will improve our blood sugars after the meal. And also we can need less insulin for the same amount of carbohydrates we're having, which helps control and manage the postprandial blood sugars. And finally, those are very important factors that are to be taken into account all the time, unfortunately, on a daily basis, is your insulin timing, your insulin dose, and covering your carbs with insulin. So unfortunately, with type 1 diabetes, we don't necessarily have free carbs. So snacking between meals is not necessarily going to help you control and manage your blood sugars. You really need to match it with insulin. And when that happens, there's other factors that we need to take into consideration. So I don't want you to start taking insulin with your snacks today. You really need to sit, especially if you're on multiple daily injections, you need to sit with your dietitian to go through that with him. Okay? Thank you so much.
Thank you very much, Ma. That was very interesting. So I only have 3 questions in the Q&A. So if you have questions, please go in the Q&A sections and feel free to ask anything you have in mind. So our first question is about the difference between whole wheat bread and whole grain, or in French, pain intégral.
Wait. So the pain intégral is how the flour is transformed, and they keep the fibers in it. So that's why we're gonna go more towards the whole grain and pain intégral, farine intégrale. I don't know what's the word in English. It's better. The whole wheat, sometimes they're gonna use white flour and adding fibers to it. So it's not necessarily the same impact on the blood sugars.
Okay, interesting. I didn't know that. Thank you. The second question is not really related to our topic. It's about microplastics and food, so I don't think
I can't answer it because I didn't do research on that.
Yeah, so we're gonna go to the next one. Someone is confused, saying if you eat the same meal at a restaurant and the same meal at home,
Yes.
why would the insulin dosage be different?
Yes.
Can you answer that?
So, of course. And that's a very important question. So thank you for asking it. So when we're eating at a restaurant, the amount of fat used to cook the meal is higher to what we're using at home. Because we want the food to taste better, and fat brings the texture, gives it a nicer texture, a nicer, taste. which is very normal. What happens is when we're having higher fat on the meal, this will increase what we call the insulin resistance. By increasing the insulin resistance, the insulin dose that we're using doesn't work the same. So you need more insulin to do the same job because of the fat there. To complicate things, what happens is if we're having too much fat, the fat will delay the digestion. So if I show you, I'm going to go back to my here. So by delaying the digestion, let's say the restaurant food, the peak is here. Let's say I'm going to put it here, but your insulin is peaking 2 hours, like at 2 hours, but your digestion is peaking 4 or 5 hours later. What's going to happen is you're going to go low. And then when you really are digesting the food, then the blood sugar starts rising later on, which leads us to, we need to split the dose, increase and split the dose for a restaurant meal compared to when we're eating it at home. So the management of a restaurant meal is different.
Interesting. And the next question, I was thinking about the same thing about salt. Is salt a component of this diet? And what are the implications of salt in the diet?
Okay, so this is the Mediterranean diet was labeled for cardiovascular diseases. They don't necessarily talk about salt. We have the other diet that is called DASH diet that is recommended for management of hypertension. At the end of the day, all of them meet to the same criteria. Without talking about salt, the fact that we are cooking at home, that we are using food that are less processed, they're not in boxes, they are not in cans, they are not frozen, but I have exceptions for frozen vegetables. Example, we can use them still because we don't have salt in there. We are indirectly reducing the salt intake. In the DASH diet, they specifically say we need to reduce the salt under 2.3 grams a day. So they specifically say it, which is not the case in the Mediterranean diet, but we achieve that goal in a different way. So that's why, like, this is the main difference. And salt, so sodium, doesn't impact the blood sugars. It impacts the blood pressure. Okay? So it's not going to change anything in the management of the blood sugars and the insulins.
It's more a question of health.
Yes, overall. And again, we are reducing cardiovascular risk with that, and salt is part of it, for sure, because of the blood pressure. Because diabetes, blood pressure, and cholesterol are the 3 best friends. So cholesterol, we treated with the Mediterranean diet, the salt by reducing the hypertension by reducing the salt, and then the diabetes by managing the insulin according to what we're eating.
Thank you. And you were talking about frozen vegetable. I have a question about that.
Of course.
Is there a best way to eat vegetable between fresh, frozen, cans?
So we pick our battles. I'm going to say it that way. For the canned vegetables, we have more and more options without salt, so we can go towards those. The frozen vegetables, as long as they're not seasoned, as soon as you see seasoned vegetables, usually we season them with salt. Unfortunately, it's not with parsley and oregano. It's salt. So if we stay away from those, so just frozen vegetables, sometimes it's better than the fresh, especially in winter here, because it preserves the vitamins and the mineral in the, like we freeze them in the vegetable till our plate. But eventually, if we have seasoned vegetables or fruits, yes, we'll go towards those for the taste too, to enjoy the taste, not necessarily only to have the vitamins and the minerals. Fresh tastes better. In some, I'm gonna say in summer.
Okay, well, I don't see any other question. I don't know if anybody has something else. Want to add something else? Well, we have thank yous for clarifying types of vegetables, and thank you for your answers.
My
So
pleasure.
it was much appreciated. This one here,
My
we
pleasure.
a last one. We need, but I don't know if you can answer that. We need iodized salt in our diets to avoid thyroid disease, don't we?
Yes. Yes, but it depends on the amount.
Mhm.
So that's why we have the salt here in Canada. They add the iodine to it for that. But we don't necessarily need a big amount. We rarely see a carence, what's carence now in English? We rarely see like a deficit in iodine intake because we're using the iodine salt.
Okay, so we don't need a lot more salt
No, no.
than we find in the food usually
Yes.
that we buy.
But
Okay.
that's why we put whatever our population is missing, but depending on the country, right? It doesn't, like in other countries, they don't add iodine to the salt. But here, because we need it, they add it to it. So we don't miss some. So yes, but that doesn't mean that we need to put salt everywhere. Like we don't need a bigger amount. So that's why we need to find a balance between when we're doing something, not creating another problem. You know what I mean?
Mm-hmm.
Always need that balance.
Yeah, it's a key word. Okay, so I guess there's no more questions. So I will invite you all for our next webinar in September. It's going to be about back to school with type 1 diabetes, a good topic with the school arriving soon. So if you know any parents in your neighborhood around you that have children living with type 1 diabetes, please talk about the Better Project. Send them to see our website because we always need more people in our registry. So it's going to be more diverse and we'll have a better look of people, Canadians living with type 1 diabetes, of course. So thank you very much, Matt. Was really appreciate. I think your presentation. I see other thank yous on the Q&A.
My pleasure.
So
my pleasure.
I wish you all a very good rest of the day, and we'll probably see you in our next webinar. Bye-bye.
Bye.